Hello, my name is Virginia Villarreal. Thank you for the opportunity to speak with you today about medication management, a topic that has been problematic for all of us as healthcare providers. Most importantly, it has caused poor outcomes for our patients, which could have been prevented. Exactly what is the problem? Non-adherence to medication regimens. As healthcare providers, we have all heard many reasons patients give regarding non-adherence to medicines. If we are honest, we too can recall a time we've missed that dose of antibiotics when we were given a QID regimen. In the next 10 minutes, I will cover some highlights of the issue of non-adherence, its impact on patients and our hospital, and what can be done about it if we implement the use of available technology. Some of us have grown up with the one-a-day model as the popular multivitamin touted in its commercials. Just one vitamin a day is all it takes to be healthy. Today, with all the advanced pharmaceutical research, clinicians have more drugs to treat patients with. It is not uncommon for the average adult to be on 3 or 4 medications or supplements. As we treat chronic conditions, the number of medications increase per condition. As new diagnoses are identified, medications to treat them are ordered and the cycle is repeated for each new condition. The additional number of prescriptions can foster non-adherence to medicines. The slide shows a projected 278 million prescriptions will be filled in 2012. And 287 million is the projection for 2013. The 2012 cost estimate for these prescriptions is $9.948 billion, which is up from 2002 cost of $3.238 billion. Since we spend billions of dollars on medications, we hope our money is well spent and patients are getting the benefit of those medicines. However, a recent study in the Journal of the American Pharmacy Association identified that 50% of the time, patients do not take their medications as prescribed. The same study estimated the cost of non-adherence to be $177 billion per year. A Canadian study revealed that 12% of ER visits were directly related to problems with pharmaceuticals, which makes appropriate medication management a high priority. Patient safety is a priority in our organization, and we can make a positive impact on it by improving medication adherence. In doing so, we limit the risks of suboptimal drug therapy, which can adversely affect our patients. The majority of patients have a cell phone they use frequently. Many phones have programmable software applications built in. There are also many services on the market now that one can purchase to assist in medication management. By utilizing the simplest software, the reminder area of the patient's cell phone, a volunteer can program the patient's medication regimen. The name of the medication and the time of the day the patient needs to take it will show up as the patient is alerted to take the medicine. I propose a station should be set up for programming the cell phones. The station can be called something the veteran can relate to, such as medication headquarters. Volunteers, such as retired engineers, retirees who have worked in technical fields, or individuals who are able to program phones easily, can operate the station. A VA staff member can oversee the station by checking in with the volunteers every morning and periodically throughout the day. Can we do this? Yes, we can absolutely do this for our patients. Outlined are 5 steps to accomplish this. For step 1, no additional space is necessary, as the pharmacy area is set up for patient teaching and provides privacy. The volunteer can be called in to program the patient's cell phone after the pharmacist's teaching is complete and the current medication profile is available. Steps 2 and 3 require that the project be marketed weeks in advance to all employees and patients. One way to market this is by using the TV kiosks throughout the hospital, where the message can be repeated frequently. By informing the patient and the staff of the positive outcomes of better medication adherence, such as decreased ER visits and decreased unscheduled clinic visits, they may be more inclined to have buy-in for the project. For step 4, the veterans organizations can be the network for locating volunteers. Step 5 can be used to stimulate positive reinforcement by posting weekly numbers of people visiting the station. This can also be reported in the hospital's weekly bulletin. If patients can benefit from better medication adherence, so can employees. Here I have listed a few of the benefits to our facility if employees improve their medication adherence due to our marketing efforts for the project. Increased productivity, decrease in absenteeism, and a healthier workforce. The employees should also have access to the medication headquarters if they are interested in having their phones programmed, and should be encouraged to visit the station. By programming a patient's cell phone, we can support patient safety, improve patient outcomes, decrease ER visits, and promote cost effectiveness. Medication adherence is very doable. Many medical emergencies can be prevented with proper medication management. You want this for your patients, and they will love you for it. The takeaway here is simple. We can improve medication adherence by programming patients' cell phones with medication reminders. At this time, I will be happy to answer any questions.
What about patient privacy in using volunteers?
That's an excellent question. Since our hospital follows the HIPAA guidelines, all volunteers are certified for assisting patients in our facility.
What if a patient is uncomfortable with a volunteer programming their cell phone?
If a patient is uncomfortable with a volunteer programming his or her phone, the VA staff member who is overseeing the station will program the phone. I hope you consider this proposal as a project for the next quarter. Thank you very much.